So ours is negotiating female fitness doping, gender identity, and transgressions. So kind of this was interesting as it talked to one of the big things that I noticed right away is it talked about PIED, which is performance and image enhancing drugs, and that kind of led into like they talk about like workout culture and stuff and how that's a big impact of the performance and image enhancing drugs, which are very similar but less studied in the effects of the body. So women's PIED use has increased in, like as I mentioned, the fitness culture, and so a lot of this stuff where the, the the context we know it as like bodybuilding or other sports, and a lot of that's male related. And so there's the double gaps kind of in like the research here, and that's kind of where they wanted to look. The other thing they mentioned is that female bodybuilders don't they even have to struggle with some stereotypes that like the men bodybuilders don't have, and like the way they shape their bodies is still a little different in terms of their femininity and how they appear. So some of the theoretical framework. So it's focused mainly on two areas as we talked about. So the sport doping and then the fitness culture and like gym. And it's kind of interesting. They studied that really not a lot of this fitness culture, but they talked about the concerns of fitness PIEDs because you're not these are maybe a little bit above like a normal person working out in the gym, but it's not someone who's like competing in like an athletic sport for money or for amateur status or something of that nature. So they had the umbrella project that they worked out of, and what of that mostly came from was they were in the gym for several years, kind of analyzing this stuff firsthand. They developed this project out of that, and so they conducted interviews, engaging in formal conversations, observations, and with online but also face-to-face communities. They went to other places and got out there and were able to kind of get the firsthand experience and talk to a lot of people who were like using this, as I say, doping. And then first they had a rich quality of data generated through in-depth interviews, and then secondly they had the written accounts from fieldwork studies that they got on their own.
So the results were kind of it was kind of all over the place what all they were researching. But their results they looked a lot just at like the social norms and ways people were viewing women using the PIEDs. So it was clear that the women using these PIEDs were promoting the positive. So in written accounts and magazines articles, women are really promoting these PIEDs, talking about how they can help you look better, even perform better, while kind of ignoring the side effects, really downplaying the side effects. They also women focused on the fact that they experienced a lot of joy and happiness, just feeling better about themselves, things like that. That's what they were saying, writing in these articles and things. And so both of these things have led largely to the PIED use becoming more acceptable and normalized for women in society. So the discussion along with that is that females' use of PIEDs is directly related to the pressure society puts on women to look fit, and so it kind of talks about that women in the past it was more you want to be really skinny. Now it's becoming more acceptable and almost looked at as a really positive if women look stronger. So that's becoming more and more popular thing that some women are trying to look. It kind of goes along with it here. There's been a change over the recent years. And so women that are competing in sports see little reason not to use these PIEDs because, like I said, they're focusing so much on the positives that these women are seeing, I'm not going to get caught, not going to get in trouble for doing this. And the side effects are honestly pretty low, is what they're reading. So it's kind of led to them more and more popular. Other comments, we're seeing PIED usage from women become more and more common and acceptable for women because side effects are rarely discussed. And those that use PIEDs are really, they try to bring other people in with them. So, you have some bodybuilders or even just fit women and men that use these PIEDs. They're going out of their way trying to encourage other people to do the same and to also use them. Society puts more and more pressure on the way women look, look a certain way, so people are willing to take a risk and taking a experimental drug to try to help them look better. So that has also increased PIED usage. There's a reference.
Still claps? Very good. Everybody, I mean, you two, was that your third presentation?
Yeah, that's what I thought. Excellent.